Every encounter with a child is like a divine appointment. Every child I see is like I'm meeting a god.
Which age group is the most difficult to manage?
Every
Young
single
babies.
child is a challenge,
Ah.
but this newborn challenge is from parent. See,
So
back
is it-
then in 1990s, there used to be 63 deaths per 1,000 live births. Now the science has improved, technology has improved, the facilities have improved. So we are able to save more kids, 17 per 1,000 live births.
Hello everyone. Welcome to the Momcast. Our guest today is one of Bengaluru's leading pediatricians. With over 25 years of experience in her field and an expertise in child nutrition and development, she is here to share her vast knowledge and answer our questions. We welcome Dr. Sowmya Prashanth to the show. Welcome to the Momcast, Doctor.
Hello. Hi, nice talking to you, Amrita. Thanks for calling me on this podcast.
It's our pleasure, Doctor. It's an absolute pleasure to have you here.
Thank
So we'll begin the podcast and we'll talk about you a little bit. Are you from Bengaluru, Doctor? Have you always been here?
No. I am basically from Mysore. My father is a general practitioner from Heggade-Devankota. It's one of the remote taluks of Mysore. He was one of the first doctor to be educated from that village. And now I was the first lady doctor to come out of that village.
Wow.
So I basically come from Mysore, but I got married to Bangalore. But I stay here for 25 years.
Wow. So almost as long as you've been a doctor, you've been
I'm
in
here.
Bengaluru.
Yes.
Right. And why did you become a doctor? Did you
As I
always
to-
want to? I'm sorry.
As I told you, my father was a doctor and my mother wanted to be a doctor, but her dream was not complete. So she always instilled that thing that I wanted to be a doctor. It's such a noble profession, and always a lady doctor is needed because there was dearth of doctors then in my mother's era. Then she wanted me to, that's the most respectable occupation she thought then and now also. And my liking to becoming a doctor only over years it became strong, because initially whatever movie I saw, I wanted to be a police, I wanted to be a teacher, I wanted to be an actor, but nothing encouraged. After I went to my school days, like high school, I went to Mysore because there was no English medium schools in our town. So once I went to Mysore, once I learnt more about biology, my love towards biology and the inquisitiveness to know more about human body, that led me to become a doctor. And I graduated from JSS Medical College, one of the prestigious college of Mysore.
Wow. Yeah. So we have to thank your parents.
Yes.
Apart from yourself, we thank your parents that you
Yes,
became a
yes.
doctor.
I was the first lady doctor of the town, and
That
my
is-
father was the first doctor at
Wow.
that place.
Yeah, no, that's great. I'm sure the town has many more doctors.
Many more doctors.
Because you both
Yeah,
started
yes.
it, pioneered it.
Yes.
So yeah, even a bigger pleasure to have you.
Thank you.
Yeah. So, and why particularly pediatrics? Was your father also pediatrician?
No, he is a general practitioner. After I married and came to Bangalore, now I live in Jayanagar. After my I had just completed my internship, I was not aware of what to take in my post graduation. So, but I stay in Jayanagar. I was I wanted to spend time while studying for my post graduation. I wanted to do some residency. So I joined Indira Gandhi Institute of Child Health, one of the prestigious institute for children's health. As I went learning there and experienced the work, there I had a Bhishma Pitamaha of pediatrics, that is Benakappa. He was the founder of that. Such a nice person. He instilled the knowledge. He told us what is pediatrics, how to deal with children, how much of infant mortality and child mortality is there, and how we can change this world by giving better health to the future generation. There I thought, though initially I thought to be a gynecologist, but this led to more interest toward pediatrics, and I studied hard. I got a seat there. I continued my master graduation there. I ended up as a good pediatrician coming out from that particular college.
Wow. Thank you to your Bhishma Pitama as well.
Yeah, I owe a lot to him.
All right. So, doctor, when we talk about Okay, first of all, can we explain pediatrics to the layman watching
Yeah.
the show?
Pediatrics is that word is the healer of a child in Greek. So pedias and trix or tros means a healer of a child. So we are dealing with children who are from newborn to the age of 18 years.
To the age of
Yeah,
18 years.
we become almost a part of their family. Since the time of their birth, we are there to receive them. And
Yeah.
the adolescent till they grow out of that 18 years and
Yeah,
teenage and become an adult, I'm there for them.
Yeah.
And not only cater to their illness, it is not that pediatrician has to just take care of their cold, coughs and flus. We also have to see how when the child develops, how the development is going on. Is the child getting proper nutrition? Is the child physically, emotionally and socially well behaved? It's not just a physical, mental and physical fitness that I cater to.
Yes.
It's a complete well-being of a child, and that is what we deal with. And pediatrics doesn't mean only less than 5 years. So some of them still ask me, my child is going to college, can we come and show you, because we are so used to you. I said till 18 she gets married, she's there, and again few years later she'll get the baby and come to me. So you can never get rid of me. Yeah.
So you become family for
Family
people,
for them.
basically. Wow. It's a very, very important role, and wow, a role of such high responsibility, I'm sure,
Yes,
doctor.
yes.
So in your journey, you've been a doctor, you've been practicing over 23 years, 25 years now. What are some things, see, your knowledge and expertise aside, you're obviously very well trained and very well qualified. What do you think are your biggest assets when it comes to dealing with children? Like it could be soft skills, management skills, whatever it is.
See, any physician need to have a good, strong knowledge about that particular field, right? But here, just knowledge and the skills are not important. Soft skills, as you spoke, is more important, because everyone will know what drug to give for cold. Everyone will know what to prescribe. Even the general practitioner will do what we do. But here, we need to have more communicative skills, because child is non-verbal in a very young age group, or a neonate or an infant. They won't tell you where the problem is. They just come, parents are worried, they carry the baby to you and they want you to assess what is there. So when they are non-verbal, you have to know their non-verbal communicative cues. You just observe them completely. You need to be more, see, when they come, they are all, even the slightest thing for them is so worrisome. So parents come running to you for even slight a bit of cold, cough, or even the baby cries, they come with the whole family. Here, you're not catering to the child, but you're focusing, though you're baby centered, your focus is for the family.
Yes.
So you have to have lot and lot of patience. So patience comes number one for pediatric. P for pediatrics is patience. I get to hear from my colleagues, how can you tolerate this cry? See, their baby cries only, they can't manage. My clinic is all cries and laughter, everything. But the positiveness we have to see. When I see a child crying, coming to me, when I treat them and they smile at me, that is the reward I get. So we should look for a benefit, positive rewards which we get by treating a crying child. And communication here, because you deal with different kinds of people, we should know different languages also, because kids sometimes they don't know English, and when you ask questions in English or in Kannada or whatever, if we talk to them in their own mother tongue, they communicate to you better. So better to know many languages. I speak 5 languages fluently, so that has given me an advantage or edge over some other pediatricians, because they love to speak in their own language, they want to communicate, especially grandmothers. So when you can talk to them in their own language, you get to get more history from them. And like our teachers used to tell, more than examination, it is the history which gives you. History means the complaints when you patiently listen.
Medical
And history, when they talk, you cannot bluntly ask, what is this, and end it up. You should give time for them to explain. So during their explanation only, you get to know what the problem is. Even before you start examining, you will know by listening to them carefully. So listening skill is one of the skill which we need as a pediatrician. And empathy, that anyone will have as a physician, but here you need to empathize and sympathize more, right? And you need to be trustworthy, because they have brought the precious child to you and they believe in you. They think you can do wonders. So you should put yourself in their shoes. Like if I had a baby in that place, how would I treat it? And how would I do? What would I do? Would I medicate them or would I wait? Would I counsel the baby, mothers? These things are the main important skills which a pediatrician should have, and you should be transparent in what you deal with. You can't over do things because you can't, most of the adult patients I see, they go for blood tests. First day fever, they are into many tests. We don't do that. We wait because each prick is a painful procedure, and until unless you need it, we don't do it. So that is the skill as a pediatrician compared to other physicians. We don't diagnose by testing, we diagnose by talking.
Yeah, that just gave me, yes, you cannot just go and give tests to babies,
Yes.
right? I have more empathy for pediatricians now, just like you have empathy for your patients.
And your patient comes first than the family, you know, because they are calling you anytime, and you have to stop your routine chores of the house and hold and run to attend deliveries, and there may be people at home who are saying why you are not giving attention at home, but prime importance is the baby. Next comes your own baby. That should be there as a pediatrician.
It's a baby, right?
Yes.
Yeah. Yeah, you're totally right about, you're not just treating that baby, but also the baby's entire family.
Family, yes.
Yeah, because you get so nervous when something happens to a
Yes.
little
And
baby who
each one
cannot
will
explain
have
anything.
their own version. You know, mother-in-law will be telling something, father-in-law will be telling something. We have to patiently listen to everybody. If I don't, they get offended. So I listen to everybody, counsel everyone, then come to a conclusion and treat them.
Out of curiosity, doctor, what are the 5 languages that you speak?
English, Hindi, Kannada, Telugu and Tamil.
Ah.
Little bit of Malayalam, Bengali, as much
Little
as
bit
I
of
can.
Gujarati also.
Gujarati, no, not much.
One day I've
Dikra,
heard you
dikri,
speak.
all those things.
Yes, like little bit, yes.
Yes, yes.
You do know that much, which also a lot of people wouldn't know. So
Yeah.
quite a skill
That is a curiosity, just to learn languages.
I guess doctors have to study so much that they are able to pick other things up also, just because you're used to studying so much.
Yes.
Right. So, doctor, now that you've been practicing again for a sizable time, do you see any major differences between, like, generations have changed? Medically, don't they say like every 5 years is like a different generation?
Oh, not only medically, everywhere it is different.
Okay.
I belong to 90s, where my first child was born in 2000s and then second child in the late 2000s. So each 5 years there is a lot of difference, from millennials to Gen Z to Gen X. So though the medical thing knowledge is, we can upgrade by reading, but the technology has changed and the parenting styles have changed. Parents have become more worrisome because there is little delay in the marriage, and every child is precious. Even you are married at the young age or you're married late, every child is precious. But when they have a child after 35 with so many infertility treated cases and preterms and IUGRs, and when they get their baby, for them it's the last thing resort is to have a good healthy baby, right? So it gives some more pressure on us. They say whenever they come to us, it's a precious child, it's a precious child. Every child is precious, but when they say it is nothing but that baby for them. So in such cases, these precious children have increased nowadays because of little late marriages, and infertility numbers have increased. And when preterms are born, or when they have gone through so much of stormy period in the neonatal life, you have to be more cautious because they have many more comorbidities attached. So such things have increased. But
Can you explain comorbidities, doctor?
comorbidity means if they are born early, they might have little increased wheezing episodes, or they might have developmental issues, they might have IQ low, they might get repeated infections. So such things have increased.
Oh.
Though we are able to save more kids, more developmental disorders also we are seeing. See,
So
back then in 1990s, there used to be in neonates, means a child, baby who is less than a month, There used to be 63 deaths per 1,000 live births. So it was very, very high. Now the science has improved, technology has improved, the facilities have improved. So we are able to save more kids, 17 per 1,000 live births. So we are there to attend any deliveries. We are supposed to be there. Because the moment the baby is born, you are supposed to resuscitate the baby. If the baby doesn't cry, they will become handicapped for life. They'll become mentally retarded because they are oxygen deprived. Back years ago, this was not there. Not all the deliveries were attended by pediatricians. So we used to see more of cerebral palsies. You might be seeing more of like deformed limbs, unable to walk. Those things have come down significantly. But autism spectrum disorders, maybe we are diagnosing better, or the incidences have increased because of high risk pregnancies and environmental pollutions. And now the digital savvy kids, some social media have also changed. So these are the major changes which have happened from generation to generation.
Positive things have also happened in that the
Positive
number
and
of
negative. But negative things, I would say, like obesity. Back when I did in Indira Gandhi, we used to see malnutrition, like marasmus, kwashiorkor, where food they were deprived of food. Now we are seeing
the opposite problem.
I am seeing more obese babies and more diabetic kids, hypertension at the young age. So this spectrum has changed. So both are bad. This extreme where I was seeing a malnourished child was bad. Now we are seeing an obese child is also bad. So we have to balance both. Correct both, I would say.
Interesting, as well as a little scary, right? That these kind of problems are on the rise.
Yes, too much.
So, doctor, what other effects do you see of technology on today's children? Right? We talked about like technology has changed, and of course, assisting children. But for example, I often hear, not here, I found out this like last month. This is a guideline that children under 2 years of age should not be having
Exposed to
any screen time at
nothing.
all,
Yes.
because technology has such adverse
I hope you're not
effects on
showing
them.
any screen to your child, Amrita. See what happens the way when I see, when they come to my OPD, we are about to give vaccination. First thing they open is the mobile. Doctor, stop. We are going to show him cocoa melon. Then only you vaccinate. This is the trend now. So they're using this mobile phone or the screen time as a pacifier, which is very, very wrong, because they want to listen to lullabies, they want to listen to songs which parents can sing, which grandparents did. But here, first and foremost thing what they do to pacify a child is showing him the screen or her the screen. So that is the wrong thing. So many ill effects have been noticed. There has been vast number of studies done on this screen time, and less than 2 years, absolutely, WHO has recommended zero screen time. Other than showing the baby to your grandparents who are staying far away by video chatting, you can show your baby. But you cannot use the screen as a pacifier. And above 2 years also, you have to have a restricted time, because half an hour to 1 hour maximum, that too with co-watching. What is co-watching? See, initially when we were started reading storybooks, we had imaginative things.
Yes.
Like when mother read the story about thirsty crow, you imagine how the crow is, how it will fly, how it will go to the jug, pick up the stones, and all you imagined. But here you're just watching it. See, when you watch, after you watch, you need time to process things, right? You just watch here, and before you start processing what the stone looks like, it is moved to the next picture. So child would not have an imaginative learning. So child lags behind in the language and social skills, because you just tend to hear. See, language is just not express. They won't know to express. They will just listen. And you need to have a three-dimensional exposure. Here is a 2D exposure in a screen. But when you handle a mug, you know how to handle, how big it is, how heavy it is.
3D exposure.
Yes. And when you, like, children have to play with toys and stack the cubes and all that, right? they're watching Cocomelon do it or somebody do it. They don't know how to do it. They're just seeing it. But when you allow the child to do it, he has to lift up the cube, stack it on each other, how heavy, when it falls, again how to take it. So baby has to learn by experiencing and not by seeing. It has to be experienced. Be it climbing the stair, you have to allow it. But somebody is climbing, you can't learn. It's like that. So about to like up to 2 0, after 2, co-watching what it will do. If parents sit with the child and something very appropriate for the child, something you want to teach about parts of the body, you sit and they're showing eyes, nose and all. You ask, where is the nose? With the child. Then child points out to the nose. Yes,
Interactive watching.
interactive. That will help. But allowing child to sit with the mobile and you are doing your household chores, of course, both of you are working, you have to juggle between your household activities and your office and the baby, and you use this as a breather. But that is not going to help, not neither now nor in future, because you're not going to give good environment for the child. But instead, if you do this and child answers you back, and when questions, when he answers, language starts developing, cognition improves, IQ develops. Okay, but unfortunately after 5 they start seeing more of television, because now after this COVID especially, they were given all the notes through the digital media, right? So we were forced to give them phones. So that 3 to 5 years, half an hour to 1 hour. But after that, educative videos, if you have to, again you have to see with the parents, with co-watching, and all the other things which are not appropriate for that age has to be blocked off by your digital media.
Has to be regulated.
Regulated. Otherwise, it is going to expose them to unwanted things. And always you should have a free time, like meal time and screen time can't go in hand. They don't enjoy what they eat.
So that is the most common time
very
for
bad.
screen time
Screen
actually,
time.
because kids don't eat.
So what they show?
So-
See Cocomelon and start
eat.
feeding. They
Yes.
don't even chew. They just start
Yeah, they
gulping.
just-
And those are the ones who go later to school and come back with their tiffin box back, because they haven't learned how to chew. So, and always it is, see this, they will open, they will be fed, they are gulping. Once you stop the screen, they stop gulping. It is like that. So they are conditioned to it. And they are not enjoying the texture, the color, the consistency, nothing. They are not noticing it. So allow them to eat by themselves. Screen and meal time cannot go hand in hand. And you have to have a common meal time where you sit with a child, with the family, and allow him to eat. Especially now baby-led weaning, you must have heard. They have to touch the food, the tactile stimulation. Then they have to take the food to their mouth by themselves. These things don't happen when you're feeding them with the spoon when they are watching the television, right? So they become poor eaters. And adolescent kids, though, few more restrictions you have to do. Free zones, screen free zones. No, they can't take their screen to the bedroom. They have to have screen free time during meal time. At least they should not open their mobiles. Otherwise, all of us sit at the table, each one is watching their own phones. So where is the interaction? When do you know about your child? What is happening through his in his school, or how has done in his school? What appraisal he has got, or what somebody has praised him, or somebody has bullied him? Nothing you get to know. So family time, no television or no screen time. So many ill effects.
So this is like this is the kind of information that we want to put out. Like people roughly know
Yes.
that screen time is not
But still
good
they
for
can't
people.
avoid it. It's
Yes,
become-
because it's kind of a byproduct of the nuclear family situation, where just because there are so few hands to attend to a child, you have to resort to the nearest solution you have, which is often the screen.
Yes.
And that statement is there, no, you need a village to raise a child. Unfortunately, people don't have those villages these days.
No, nuclear
So it's
family
becoming, that's why it's a challenge for people. Yeah, these are the times when I'm like, let's go back in time, invent a time machine, go back.
Yes.
But yeah, not good for everything, but definitely
eye
probably
problems
better.
have increased. I used to see less number of kids wearing specs. Now many kids are wearing
Screen
spectacles.
time.
Yes, because screen time has increased.
Yeah, makes sense, doctor.
And they don't pay attention. Their sympathy is also lost. See, when you are asking, if you're calling him or her by name, they're hooked to it. If somebody has fallen next to them or crying, also they don't pay attention. The empathy also has gone. So this is taking away from their social relationships.
Sort of
Be
sounds
it
like it's taking away from their humanity a little bit.
humanity, in fact. So we should
Hmm.
correct now, or it will be too late to correct when they are adults or adolescents.
Fascinating and scary, doctor. Yes. So, doctor, when we talk about nutrition, you just mentioned, right, that in the 90s we were seeing children who were malnourished. Now we are seeing the other end of the spectrum, where children are obese, right? When we talk about nutrition in children, especially in babies, in infants, right? How do we begin on the right note? What do we feed newborns, and then as they get into toddlerhood, what do we feed them? Because in India, baby formulas are quite popular, and we recently learned that they are
Yes,
not
yes,
always safe,
yes.
right? So how should we begin
No, they
children on the?
themselves have put that breastfeeding is the best thing in the formula.
They
Like
have to,
they
right? There's
have
some
to,
sort of a
so
rule.
they have put it. And as a pediatrician, I'm strongly against these formulas. And we are baby friendly hospitals. Like wherever the delivery happens, we are not supposed to advocate them formulas until unless there is a real need for it. See, formulas, cow's milk and breast milk, there is a lot of difference. Breast milk is tailored milk for your baby. No, nothing else can replace it. See, every mother, when they deliver immediately, they produce something called colostrum, which has all the antibodies which your baby, like Amrut, on that is, it is going to protect you for lifetime. So, if you are deprived of that, how will you give your baby any good immunity? So all the immunity against malaria, dengue, whatever flus and common colds and deadly diseases, mother gives you antibodies through breast milk. So you are naturally protected by that. So as soon as baby is born, we are supposed to give mother's milk only, and within half an hour that too. Mothering in we call. So baby need not be isolated. It should not be made to sleep in other crib. Rather than that, bring the baby directly to mother's breast and skin to skin contact and initiate breast milk production at the earliest. That helps. Skin to skin contact helps the baby to latch. It is nothing to learn. It is an innate thing. Babies know how to crawl to the breast, how to go and latch to the breast. It is not a science at all. But nowadays, moms are taking it so as if it's a rocket science. How to breastfeed, they read. How to do that, read. See, it's a natural thing. More you read, more you stress about it, more you fuss about it, more difficult it gets. Nowadays, we do have antenatal classes and we teach them how to prepare for breastfeeding, and so that they are confident to feed the baby at birth, at immediately after birth. Why breastfeed compared to formula or no to cow's milk? Still, we see some of the grandmothers feeding cow's milk. Cow's milk is for calf. Human milk is for human body. See, like a baby, your baby's weight, height, how it improves is it doubles its weight by 5th month. So this much amount of calorie, this much amount of carbohydrate, protein is catered by breast milk per day, and as the days progress, like first month there is different calorie. Second month, your mother itself produces different calories. So it is like that. She is making it as and when that day, particularly on what she eats, that also affects. So, but cow's milk, it is standard. Formula milk, it is standard. Set with so much of sugar, so much of protein, so much of fat. But whereas breast milk, it varies. So, from the time of birth itself, or even in the womb, when what mother eats influences the baby. So, mother, if she is more likely to eat more sweets, more sugars, baby will tend to get preference to sugar. It is proven. But if breast milk is given and mother starts eating all kinds of food, baby gets exposed to all the textures. Like every day it secretes in your breast milk, baby gets exposed to all kinds of food. Whereas calf, which is born, which is doubles its weight within 40 days. So what does calf's mother give it? More protein, more fat and more sugar, right? Less sugar, in fact sugar is okay, but cow's milk has more fat and more protein, which you are not able to digest. because your gut is different, your kidneys are different. So never go for cow's milk. But initially in 15, 17 centuries and all, they substituted for cow's milk. Then they got to know that cow's milk is not an alternate. They went to goat's milk, donkey's milk, everything was tried. But proven was cow's milk was okay. But cow's milk had more protein called as, they have casein, and we have whey protein. So casein, if you give more to a baby, they will not be able to digest, and they will not be able to dilute in their urine and pass it on through the kidneys, because your kidneys are not mature. The solute load, what it takes for a newborn or an infant, you cannot give that load of casein, and that's why they get kidney problems earlier. They won't be able to digest, gut problems, they start vomiting, they start diarrhea. So what infant formulas did is, they took cow's milk, they started changing some of the constituents. They wanted to give sugar at that rate, but sugar what we get through is 5 grams per 100 ml, but what they give is sometimes 8 to 10. It becomes more sweeter. So who will prefer sweet? Who won't like it? If you give a baby who is newborn and trying to give breast milk which is less sweeter, and give a formula which is more sweeter and more easy to take through palada or bottle, who they will always prefer the easy way. So do not show them that. And these formulas also, they try to mimic breast milk by many ways. Breast milk has it's like a living liquid. You are giving antibodies, you are giving live cells, your blood cells, no? You pass it on to your babies, WBCs, to protect them, because their immunity is not yet mature. So you are giving what you have developed immunity through your breast milk to your child to protect till the 6 months of age. That's why we don't need many vaccines before 6 months, because measles, chickenpox, all are protected by your mother's milk itself.
Because we were vaccinated.
So, but will the formula do all that? No. But few things what they did is, like fat. Fat in human milk is polyunsaturated fatty acid, we call. There they have DHA, which is docosahexaenoic acid, good for brain. So fat is always good for babies. And this particular that is arachidoic acid and DHA, they added in the formula also. And they claimed that yes,
it is good for babies.
We are also giving a PUFA, polyunsaturated fatty acid. We are also giving DHA. We are also giving casein and whey protein, same. And they added nucleotides. Nucleotides are the ones which builds up your body, immune system. That also they have added. Everything they added, but they can't add antibodies. They can't add hormones, which are like good hormones.
WBCs.
No, WBCs they can't add. And they are like these hormones, and they help them to sleep better, digest better, behave better. So the breastfed babies definitely excel in their IQs compared to infant formulas. Definitely you see there is a little dip in the babies who are breastfed in the weight, because mothers can't be giving so much calories in the initial days. They lose some weight, but parents and grandparents start panicking. See, mother is not getting
enough milk,
not getting enough milk. It is the perceived insufficiency of milk. They perceive it. Oh, I'm not getting. So they start giving formula. Once they get hooked to that formula, there's babies always prefer and easy ways. Parents also want easy. They want to sleep. Grandmother wants the mother to sleep. They don't want her daughter to suffer. So instead they'll say, you sleep, I'll prepare formula and give, but that's not the way. Little difficulties in the beginning, little struggle in the beginning will take you a long way, right? It's 2 years, you are so happy, you can feed so well. It is 6 months exclusive breastfeeding is the recommendation. Don't even try a drop of formula, cow's milk, water, honey, nothing else. Because
Doctor, there are cases, right, where there are women who are not able to produce.
Yeah, I will tell you where. See, if a mother is very sick, see, after delivery, she has gone into postpartum hemorrhage, she has been ventilated, she is having some major issues in her own pregnancies, and she is a high-risk mother, where you can't feed. You can't just sit and say, I have to give breast milk, I won't feed the baby. There, yes, I advocate formula feeds or even express feeds if possible. Otherwise, we do give formula feeds, but for a shorter duration until she recovers. There also, we recommend somebody else to express the milk and get it to the baby, because the earlier we put the mother's milk into the baby's mouth, the good bacteria which are there in the mother's milk will help your gut to get stimulated, gut to mature. There are prebiotics in your mother's milk, right? That helps your gut to mature faster. And there are some preterms, extremely preterm babies. Such babies can't latch, can't hold on to the breast, or they have some retromathia or a big cleft palate. Such things we ourselves tell you, either express it and give, or if not, there's no other go, we do use formulas, but never to use any cow's milk. And surgeries, some breast surgeries they have not undergone, we advocate not to give. And another thing is some drugs, if they are on chemotherapeutic drugs, they have cancers, or they have some antipsychotic drugs which are not to be given, then in such cases we ourselves tell not to give. Even in HIV cases, the breastfed feeding will not give more HIV compared to antenatal transfer or the natal transfer. During delivery they get, not breastfeeding.
Not because of
Yeah, so we
breastfeeding.
do advocate breastfeeding in them.
Right.
Okay, even during COVID, we never told anybody to stop breastfeeding, because breastfeeding gives you more antibodies. Though you can cover mouth in the if you are scared about giving flu or cold and cough when you are sick, you wear a mask and feed, but you get to give antibodies better through breast milk.
Right.
So there is no question at all to what to give. It is always breast milk and breast milk up to 6 months.
Up to 6 months.
After 6 months, yes, you have to introduce them to the complementary feeds. The earlier you introduce, better. Though we have seen kids doing very well with prolonged breastfeeding, attachment to mother increases, bonding to mother increases, but that is not enough after 6 months, because the vitamin D, iron, all these levels goes down. As after 6 months, you are not able to give the required amount of vitamin D or iron to your baby. That is when you need your complementary feeds. There we start introducing one by one different millets, ragi, rice, vegetables, fruits, and different textures you introduce early, different varieties you introduce early, the child becomes a better eater. And you should let them enjoy the textures by giving them baby led weaning. Like if they touch the food, different color, different textures, they would be better in terms of chewing, gnawing, swallowing than. But I have seen some are so strict that they will only give baby led weaning, means they give food on the plate and they will sit relaxed, but it cannot happen. There will be some nutritional deficiency. Babies don't eat to the fullest when you give that kind of food with some pieces of carrots or broccoli or something. But I have seen the weight not being up to the mark. So I advise both. First, let the baby experience, then you feed with a spoon. So both, he is learning how to chew, how to gnaw, but the extra calorie deficit which is not getting through what he ate, you complement by giving spoon feeding. So that would be ideal. And try to give all kinds of food, all colorful, all textures, all tastes, because your taste develops by experiencing only. If you stay away from such certain kinds of food, your always preferences always get delayed. You might be hearing nowadays not to add salt, not to add sugar up to age of 1 year, right?
Yes.
Yeah. So even some babies are not at all eating because they don't find it tasty at all. Okay, so but we are as strict parents, we say not no sugar, no this thing, and grandmothers will be forcing, why not give? We fed so much jaggery, we fed palm sugar, nothing happened to you, you're all right. Why? See, there is nothing like, it's not a poisonous thing to feed, but up to 6 months, breastfeed will take care of everything. After 6 months, the children's preferences starts gaining. Like if you introduce more sugary food, they prefer sweet foods even to the childhood through adolescence. That is when, if you start getting preference to more sweet foods, you will start getting diabetes, you will start getting hypertension, even chronic diseases of your lifestyle changes. No, so that's why we stop. But giving salt is not going to harm if it is a little bit, like
In moderate amount.
moderate amount, even mild amount. Moderate also don't give, little is okay. Why not more salt is, again, kidney cannot handle that lot of salt. Those so solute load is more, kidney cannot handle, and water, they get more dehydrated, they get more thirsty also. More salt, more water you need to digest, more water you need to excrete, right? So you get more dehydrated. So we have recommended up to 1 year no addition of salt. But the food content like carrot, potato will be sweet, carrot will be sweet, beans will have little salt, spices you can add. So give those tastes, but never stop giving fat. Fat is the most important thing for a baby,
So
for
when we
brain
say
to
fat,
develop. Ghee. You
ghee.
should add ghee because
Right.
fat will help you brain growth, nerve stimulation, for the nerves to get synapse, means connected well, because brain is more of fat only. So fatty food is good for a baby.
How much fat can babies?
1 to 2 grams per
1 to 2
day.
grams
Yeah,
per day.
1 to 2 spoons easily you can give.
1 to 2 teaspoons.
Teaspoons.
Okay.
Per day you should give, no harm.
Right.
And protein, good protein has to be introduced because they are growing. 1 year they double their birth weight, they need to build up their muscles. So, and protein also helps you to fight the infections.
So
So
eggs,
egg,
paneer.
if you are a vegetarian, you give paneer, yogurt, curds.
Yogurt.
Though you can't give cow's milk, you can give yogurt, you can give processed cheese and all, no problem. Okay, but soya is a form of protein. Greener vegetables, broccoli, beans, and chia seeds, all that can be introduced.
How much raw food can be given to babies? Won't they find it hard to digest?
No, raw food, very few of them eat because they can choke.
Yes.
The smaller
yes.
infant newborns, 6 months to 1 year,
1 year plus.
I don't recommend the raw foods because they can't nibble or gnaw, and they might choke. So do not try with hard foods like even raw carrot. You cannot. But
steam, you can
steamed
steam
is
it
always
and give
better.
it.
And
Right.
something which is mushy, and when it goes to your mouth, it has to become soft, and then they can swallow.
So they have to work a little bit, but
Yeah,
they should be
without
able to
teeth,
digest
they're like,
it.
doctor, we don't have teeth yet. How can we give solids? No, teeth you need not have. Your gums itself will be enough to eat those things, like
Right.
porridges, soft steamed banana, steamed apple,
Steamed up.
raw banana. Banana also can be getting soft when you put it into your mouth. But peanuts, popcorns, carrot pieces, these things they can choke. The hard things they can choke. So do not give such things, and do not even leave such objects around him, because babies explore by mouthing. Everything they explore is by tasting and touching and putting them in the mouth. So any harmful objects if you have kept, and baby led weaning has been started, they even take that as a food and they will put it in their mouth. So keep all harmful objects. I have seen naphthalene balls going into their mouth. Though, and these battery cells, they are very, very, very corrosive. They are very bad. So never leave batteries unattended. Tablets. I have seen babies taking grandparents' Tylenol, grandparents' antihypertensive drugs. So such things you keep away, because they fiddle, then hand to mouth. They are exploring, and they want to inquisitive to know what it is. By putting in their mouth only they know. So they want to taste everything they get into. They want to mouth everything. So keep harmful away from them. Harmful
Away from
objects.
them. Yes. They're very inquisitive, so it's
Yes.
hard to keep things away from them also.
But it should be very, very safe environment where
Yes.
you leave them. But you can't be overprotective also. Always keeping in them in your lap, never letting them down, never touching the floor. That is a super hygiene theory. You should never do. Let the child explore, let the child learn, let the child get some diseases. That's how you build up your immunity, right? So overly conscious parents, not letting them play, not taking them out to in the garden or the mud, touching the mud. Oh, he touched mud. Put some mud in the mouth, and nothing will happen.
We grew up eating cement and chalk and mud.
So don't worry, such things are okay. But the harmful, dangerous objects, you keep them away.
Right. And doctor, so since you're the primary caregiver, not just for babies and toddlers, but also for preteens and teens. So preteens, when children have that growth spurt, they're teenagers now, their hormones are changing
Their
and they're
calories
growing.
are also more.
Calories they need more. What kind of nutrition do you? Because that is also the age when they eat the most amount of processed food. They're running here, they're running there, they're eating all sorts of processed food.
They have access to Swiggy, they have access to can order anything they want and they eat.
Yeah.
See, this teenagers, there is two contrasts. Girls especially, I see child who's coming up to 10 years, 12 years, they're chubby, cute. After 12 years, suddenly you see a marasmic child coming in, means a thin girl coming in, and I wonder what it is. See, these girls want to look pretty, want to wear nice dresses. So what they do, they stop eating. There is an entity called anorexia nervosa. This is
Have these things increased also? Or
a
were they there
they were
before
there
also?
now also, but increased a bit because of the zero size concept, or they want to wear something nicer, like that. So I see some girls refusing to eat. So anorexia nervosa we call.
That's a eating disorder,
Eating
right?
disorder. And bulimia. They eat off
Bulimia.
and they try to gag and vomit. So these things are now little increased. But in boys, see, in girls and boys, there is nothing much difference. But in the first year, there is no difference. They all need 1,000 calories. But from 2 to 5 years, baby's boy will need 200 to 300 calories more compared to a girl child. But during puberty, the body mass index for a boy going to increase faster. Their linear growth will increase, their muscles will increase, both are increasing. For the same size of boy and a girl, the activity metabolism is more for a boy. So the requirement for a boy in an adolescent age is always 1,000 calories more than a girl. And nowadays all are hyperactive. They are into many activities, sports. It also depends. Your child is sedentary, or your child is very active or hyperactive. All that depends, and according to their calorie need, we have to cater to them.
Right. It has to be very personalized.
Yes. Processed foods, definitely no. And that's what I told, because they have easy accessibility and permissive parenting. They're okay. Eat it, what is
Gentle
there. We didn't get
parenting.
all this. So they eat and they end up in obesity, then diabetes, hypertension, joint pains, all that will start. So we are seeing.
At that age?
Yeah, they're obese at 11, 12,
Oh,
13.
oh,
Diabetes
yes,
we are seeing in 10, 12 years old. It is on rise. We are seeing more of them.
Yeah, we wanted to talk about that also, that obesity has increased a lot. And this would be the reason, I'm assuming, processed food and sedentary lifestyles.
They don't want to go out of their couch. They want to be playing in the screen or video games. No outdoor physical activities. Back in our times, we hardly have to go back to house to eat. When parents really call, come back. Here, we have to push them out. Go and play outside. Go cycle. Go swim. Something else they have to do. But they're more hooked to the screen. This is the social media which is causing this obesity, I would say.
Right, doctor. So this is a global problem. This obesity in children, which is caused
though
due
it
to
was less in a developing country like us. Though our GDP has increased, we are also now growing up. Economy has improved, but these diseases also, because social norms have changed, cultural differences have decreased. Now everything what the other countries had, we are also getting it.
Right. But always awareness is the first, I guess, step to prevention. So the more people are aware that these things can happen, these things are very common, and also these things are preventable.
And whole family should practice. What I see is mother is very strict. She doesn't want to give. She wants to give good food. Father is okay, permissive. He's saying, okay, once in a while, hiding from mother and giving that as a reward. See, I've seen kids like, you don't eat. If you eat this thali, I will give you chocolate as a reward. That is not the way. See, then the child would start eating just because she wants that chocolate at the end of the food. So that should not be practiced. So the candies and chocolates are not good rewards what you give. Instead, praise them, take them out for a while for behaving well, eating well. So that is how and grandparents. Grandparents play a major role here. They blame these parents blame the grandparents. Whoever is obese, they say, I didn't give my mother and grandparents, my father-in-law, mother-in-law, especially they blame on, saying that they hide and give things which are processed. So here whole family should know, you're not giving love by giving chocolates or processed food. You are giving diseases your child. Instead, give more fruits, more vegetables.
I guess the thought there is that we gave it to you, or your grandparents gave it to you, and you're all right, so why can't we give to your children?
No, where did we have pizza, burger?
Yeah,
colas,
exactly.
Fantas,
That's what. So the
nothing.
processed food of then versus the processed food of today.
It's
Their
completely
processed
different.
food was one samosa pani puri from the Nokkad. Now it is
And
like
we
everything
didn't
is
go out
processed.
every week. Once in a
Yes.
while we went out, but it is
Yeah.
now child can has easy access to everything.
Yes, yes,
So,
yes. It's
and
not just that grandparents are feeding him processed food. He's also feeding
yeah,
himself processed
himself,
food. So
yes,
you don't give him additional.
yes.
So it's like that now. Right. So
And they
doctor,
start hating the family homemade foods. Once they get the hang of that, they, however, parents make different, they say different varieties I have sent to the school, everything comes back. Once he comes back, because he is not eaten, they give the pizza or burger. That is not the way. Let him starve, nothing will happen. Starving, they should know. See, fussy, they make so much fuss about not eating, not eating, not eating. It's not so important. If the child is playing, active, whatever is eaten, he is able to maintain, leave it.
children are very resilient, much more than
Yeah,
we give them credit
yeah.
for. Hmm. A lot of food for thought, doctor. So I'll move back to infants now. We were talking about their nutrition. Newborn babies are a constant source of worry for their parents,
Yes,
right? You
yes,
worry constantly, right? The baby probably does not worry as
yes,
much,
yes.
right? Uh, so, what are some things like you would have seen? There would be a pattern, right? Certain things that most parents worry about, even if it is nothing. So, what will you say that there are three things which parents always worry about that they don't need to worry about is perfectly normal
Yes.
in
In
newborns?
newborns, there are so many normal things they worry about. So before discharge, I tell them these are the things. Please don't worry or don't call me. One is the babies do cry because they need to take attention. How do they call you? They have to cry. So most commonly they cry is for feed, or if they have wet their diapers, or if they're feeling too hot or cold, they have to cry. If they don't cry and if they're sleeping too much, you won't pay attention to them. You might miss on hypoglycemia. You might miss. Yes. So babies should cry. Don't worry. But when do you have to worry? If they're crying incessantly for more than 2 hours, 3 hours, then is the worry. Otherwise, cry when you take the child. If he is okay, pacifies, don't worry. And newborns do pass many number of stools. Breastfeeding, right? Breast milk is easily digestible. And each time they eat, they feed, there is a reflux, they pass the motions. Okay, so this is called as breastfeeding diarrhea. So
Oh,
when they get discharged, they go third day, fourth day when they're seeing that they're passing 10, 12 times. They're so worried, doctor, my baby has diarrhea, diarrhea, they call. So we to tell in beforehand, before discharge, that they might pass 10 to 12 stools, okay? Not passing 10 to 12 days is also okay. See, babies don't pass sometimes 10 days, but they're comfortable, there's no bloating, there's no vomiting. That is also okay. So, stool pattern, don't worry. But you have to worry about the urine. Urine is an indication of how well you feed. More the baby urinates, good amount of feeding it is taking. So lesser the urine, that means you have not fed well. High colored urine, blood spots in the urine, that means you have to worry. When baby is urinating well, don't worry. Hiccups, sneezing, occasional coughing, don't worry. Because they are all reflexes you have to do. Cough is a protective reflex. You have to cough if something is getting into your throat, right? So once in a while, if they do, don't worry. It's not a problem at all. Hiccups, not to worry. But even sometimes they breathe fast like this. That is called periodic breathing. So they cause doctor baby has breathing difficulty. No, that not to worry. It's a periodic breathing. They breathe fast and then they stop. So many skin changes happen. They get pimple like things. They get rashes. They are all newborn rashes. They are going to go away. Not to worry. And the most alarming thing I get in 4 5 days old girl baby, doctor, my baby is bleeding in the vagina. It is called withdrawal bleeding, which is normal. In a girl baby, baby can bleed in the vagina, so don't worry. White discharge in the girl baby, not to worry. They're
that
all
would be
heart.
scary for parents.
Yeah, that is
Yeah.
what. So through this media, at least the number of worries and
Yes, yes,
calls
yes.
might come down. So if a
Yeah.
girl baby is having bleeding or white discharge, not to worry. So these are the newborn common problems which they face, and you should not be worrying.
Okay, okay. And the top three things where they should worry and see a doctor. Like,
That is more important. So you can't be careless when some things are happening. Baby is not feeding at all. See, you're trying your level best. but baby is not making an effort to suckle, not taking any top feeds, not doing any attempt, not crying well. It is always sleepy. You're trying to wake up the baby, but it is too drowsy. You have to worry. Okay. First and fever. Sometimes you feel baby has fever, but most of the time newborns on third day, fourth day, they get dehydration fever. Because if you're exclusively breastfed, unable to give amount of feed, or you're overwrapping the baby, they have a myth that babies have to be overwrapped. So overwrapping.
It's a myth.
Yeah, it's need not. It should be in a like comfortable environment. Hands and limbs should be pink, and even in this temperature, they also need fan. They also need AC. Just
This
like
is something I've heard every time.
they
That,
nicely wrap it up and swaddle
yes.
it. They can't move. Then they're even if the baby is sweating,
And
baby
babies throw off everything because they're so hot and they're still,
they still
especially this thing
swaddle.
that cover their head, cover their head,
No,
cover their
I
head.
advise covering head because the
Covering head.
body mass no maximum is in the head.
Oh, okay.
So when you have the surface area being more in the head, I advise covering. But when it is too hot, when they're sweating, don't do it. Room temperature is 28, 29. Baby is comfortable, pink, and no mottling. Sometimes, no, when you're exposed to cold, you get that white, lacy mottling in the skin, and hands and limbs become blue. That is where your temperature is low. Then you go cover them. But if they're warm and pink when you touch, don't. And they do so much of wrapping that they get dehydration fever. They start urinating less, cry. Especially in the past 3 months, we have seen lot of dehydration fever cases because babies, this temperature in Bangalore have been hot for the last 3 months, and overwrapping. In it, mother also wearing sweater, topi, everything she'll be sitting, she'll be sweating. Where will she be? 88% of your breast milk is water, and some mothers so don't give water at all for her mother, right? Grandmothers avoid water being taken by a mother, breastfeeding mother. So what happens? She gets dehydrated. She won't be able to give breast milk. Baby gets dehydrated, starts cranky, irritable, excessively crying, sodium goes high. Sometimes they throw up a fit. Such time you come back. That is called incessant cry. So, but you first unswaddle, turn on the fan, let the baby have some breathing space, let them check the temperature again after 1 or 2 hours. If the temperature still persists, you have to come back. Because fever in a newborn can be as simple as dehydration fever, but can be as complicated as a brain fever. So, you should not ignore, you should come to a doctor.
Right.
Repeated vomiting. Once or twice baby vomits, little bit curdy vomiting, which comes out and like curd, nothing to worry. But still they urinate, they pass stools well, active, sleeping well, don't worry. As soon as the baby feeds, the milky vomit, which projectile and it falls far and not able to accept even a drop, you have to come back. And lethargy, not active, as I told you, please come back. Abdomen distension, breathing fast, like this. The periodic breathing settling down is okay, but this called as grunting means there is some problem in the lungs. You should come back. Right. You should immediately meet your primary physician or an emergency physician.
Wow, this is very important.
Yes.
Right, doctor. Okay, a lot of good information coming our way. Just out of curiosity, doctor, since you handle children right from when they are born to the time they're 18, which age group is the most difficult to manage?
Every single child is a challenge, but this newborn challenge is from parents, because each parent is different and they have 101 queries. When they come to my OPD, I should have good free time because they come up with a big list of questions. So they keep asking, have I covered this question and all. They'll be happy. Then I'll ask them whether I've passed.
It'll be like a questionnaire like
yes,
this one
yes,
only.
that is a challenge. But that challenge, if you face and if you're able to convince them, they get the trust in you. And then only they continue to be your baby till 18 years, right? So that is one challenge where we face first few months. Then after that, school going years, they are okay because they have confidence in you. They know this doctor, what she tells is right, we will follow. But again, adolescent and teens and pre-teens and teens, they are the one. We see this complete change. See, I have graduated as a pediatrician and also as a mother now. See, as a textbook, it is different. But as a mother, when I experienced the same thing with my boys, that was different. So the theory is different, practical is different. So practically, the most difficult age I would say is teens. And because lot of changes going on in them, physical changes, emotional changes, and social changes, they have to fit into their peer group, and academic excellence they have to do, because they have to go from college to something they have to choose to be in later, what is their occupation they want to select. So this stormy an atmosphere gives lot of challenges to them and to the family, and that is the time where you need to give more time for your child, than this newborn is the first time where you have to bond with. Second is you can't let go of this age, though they are wandering away from your control, that you can't be authoritative or authoritarian, but this is the time you need to spend more time with the child. He needs you more now than ever.
Right.
That is the problem in the teens.
Right. And teens these days, especially, one of the things that I really wanted to ask was about teenagers. Is somehow children are starting to suffer from depression now.
Yes.
Mental health issues, health crisis. It's not something that we are only hearing about happens in Western countries. It happens in India, it happens in Bangalore, it happens. It's getting common. Child therapists are are a much needed support these days, right? Why is this happening first? I mean, sure, we have social media, and a lot of people say social media, probably lifestyle as well. Is that all? Are there more reasons for it? And um, and yeah, let's start with that, then we'll go ahead.
See, as I told you, teenage, there are a lot of changes happening in your body. More hormones produced. Each hormone has its own effect. From a child who was chubby, cute, innocent, you are exploring the world in a different way. You are now wanting to know who I am. So they want to identify themselves now, and they want to become more independent. They don't want to listen to other parents more, because they think that though they have a desire of a child, they want to show that they can take their own decisions, and they get different range of sexualities and relationships. All these are happening. So, and academic performances, all are happening between ages of 14 to 18, right? So here, if peer pressure plays a major role. Here in this stage, parental guidance do not matter to them now. What peers tell comes first, then the parents. But here, what we as parents do is we start criticizing them, judging them without listening to them. So I feel why the mood disorders or the conduct disorders or depressions are happening in adults or adolescents is we are not giving enough time to them, and we are not having a family time. During this time, what we are doing is they are busy, they go to tuitions, they come back. But it is a time where we have to spend family time, listen what is happening in your school, what is happening in your college, why are you behaving differently. If we detect early, it can be corrected. See, detecting early means a child who was happy, playful stops talking more, sleeps in a different way. If he is sleeping, he is waking up late, he is not eating well, he is always to himself. They have self esteem gets lost, because
All those things are actually very common now.
very
Like every
common.
second teenager has either one or more of these
They only
symptoms.
seclude themselves, and they think they are the only thing, they don't have anybody in the world. That loneliness starts coming into them. And in this time, if you don't give attention, definitely they will have depression, psychotic behavior, all that. And in girls or boys, their body is developing, right? So girls are getting more shaped up, hips are widening, breasts are developing. But that time they want to look better, they want to change their hairstyle, which we might not approve of, or the dress we might not approve of. But we should always sit and talk what is right, what is wrong, why you should dress like this, why you should not dress like that. Take their feedings also. We have to listen to them, what is
Yeah.
going on in their mind, then correct. If you stop them, they will not correct, they become more adamant. Instead, listening and changing, if you give an option, why not this instead of this, then they might have a better option, they might choose a better thing. In boys also, body mass is increasing, your voice is changed, and you become more acne they get. So they get more time in front of mirrors than books. So we started, why are you in front of the mirror? No, it's not natural. It's natural to have, but you should give them solution about acne, what you felt during your adolescent life, how you coped up with it, and how your parents guided you. It's the same generation by generation. Everything is same. Only thing is environment, digitalization has changed, but your body has not changed, right? And your emotions have not changed. So catering to their emotions, being with them when they need you, is the right time to help them out. So if we are at them, that's only a phase. They will correct themselves and come back to it. More aggressive, more impulsive. They, whatever you give, talk to them, they give back answers. They will not have eye to eye contact. So you cannot ignore them. You should be nice, talk to them, and try to change their behavior. They will do it.
So, doctor, when such children come to you, and you're able to maybe identify some of these markers, that maybe the child is moodier or maybe has put on a lot of weight, is more irritable, uh, what do you do? Do you make recommendations to the parents that maybe this child needs to see a therapist, or how do you go about it? Because parents might not even be receptive, no, that, oh, my child needs to see a therapist.
Yeah, yeah. See, when the child walks in to your chamber, by the look only we can make out that how the behavior has changed from the child who was 5 to 10 year old when she was walking to my chamber to a child. And when the parents ask me, I want to spend some time and tell about my daughter, she will give that vague look, that angry look, because they're showing their frustration in the form of anger. So that, but I do, but counsel them, but we are not thorough counselors, you know. I need to refer them to adolescent clinics. We have adolescent clinics who cater to them. They have to give 1 hour of time, because most of the time I see negligent parenting happening, or it can be too busy with your schedule that you didn't know where your child was erring, what she wanted at that age. You didn't cater to her needs or emotions. So it is both parents need counseling and child needs counseling. You can't blame the child at one way. Both the ways it has to be corrected. Parents have to be counseled and child has to be counseled. Sometimes we have done it by ourselves, but most of the time it has to be referred. But food habits and general well-being, hormonal things, we send them to endocrinologists. There they do the test, because morbid obesity is a very very high is like BMI being more, 35, 40, 45 is not good. No, they have multiple complications. Such things you have to be evaluated. Hormones have to be assessed. Treatment has to be started, and the earlier the better. Before irreversible changes in your body happens.
How receptive are parents of the fact that they might have to take counseling? Do
They are
parents
ready.
agree?
They agree.
Oh, that's
They
good.
agree.
That's good.
But some parents where there is strained relationship, where I see mother is telling something, father is telling something. Here it is becomes very difficult for us to counsel. You go for counseling, I am all right. It's like that. So both of them should be in the same boat. See, both of them should have a positive thinking that we are going to do it for our child. We can't blame each other. You did it, you would go. Not like that. Strained relationships, divorces, single parents, these are the kids who have this more psychological disorders, I would say. So of late, post COVID, there were few parents, like one of the parent died. Now grandparents are taking care. I have seen such kids. My heart goes out to them, because they missed out on parenting. Their parents they have lost. Grandparents can't give, and they over pamper the kids. They try to give whatever materialistic things, but that won't give them happiness. You need emotion. You need somebody to be empathetic and sympathetic for you to be there. So such kids are going through this my stormy
Tough
course,
times.
and then they are going through mood disorders, depressions. For them, just counseling will do. They are going into substance abuse. See, a lot of kids like 14, 13, I see them smoke, I see them drink. First, it is the peer pressure, just a thrill it might be. Yeah, why don't you try? It's nothing big. What a big deal. Try. And we didn't have access to so many pubs and so many pub, whatever. Every road has that now. I see a child walking from school in their uniform going to the pub. So the culture you have accepted from West, not all is right. So parents have to now only stop it, otherwise it will lead to disasters, I feel.
That, yeah.
Drugs are also found in school toilets. And even condoms have been found in school toilets. So it is going somewhere else. And I have also got teenagers getting pregnant. I think gynecologists would be able to do it, talk to you about it better. But they're not emotionally or physically fit to go through all that.
Teenage pregnancy is
Yes.
also on the rise.
Yes, on the rise. So the morale has been lost. So somewhere we have to go back to our ancestor way of teaching them what is good, what is bad. Not all Western culture need to be inculcated. You can't be Westernized in some things. We should be rooted to our values, I feel.
So, doctor, when we talk about mental health issues in teenagers, right? One of the things that comes up is PCOD in girls, right? Because either due to maybe eating unprocessed food or due to bad lifestyle, not unprocessed food alone, they could have gained a lot of weight and due to leading a sedentary lifestyle developed PCOD, or the reverse could have happened.
See, most of the time it's reverse.
Most of the time it's reverse.
PCODs is most of the time little genetic based. Your aunts, your mothers must have had this abnormal hormonal secretions. This polycystic ovarian syndrome or disease happens because your androgen levels are high. Androgen is a hormone which gets secreted from the adrenals. Means kidney ke upar na there is one gland.
Adrenal gland.
Adrenal gland secretes this androgen. No? So compared to estrogen, progesterone, what a girl should have, androgens are more. So you'll have more of features like a man, like more body hair or abdominal hair. Back you get more hair, more acne. That too, acne which are little bigger than the normal acne. And they start putting on weight. Their cycles get irregular. Mood swings they'll have. Aggression as to like a boy. They become very aggressive, very irritable, impulsive. So as they grow fatter, they feel that they are not looking good. They seclude themselves from the peer group.
Mental health deteriorates.
They can't. When somebody is going for a marriage, my daughter doesn't want to come. Why? Because she thinks that I'm looking ugly. She loses that self-esteem.
Very common.
She stays away from society. She secludes herself. She sticks to her room. She becomes more lonely, and that further worsens because you are not going out to play. You are getting more obese, more complications. Then lifestyle disorders like diabetes sets in, hypertension sets in, and chances of getting married and having a child, all that goes back.
Infertility is also
more higher.
Yeah.
So, but having such things can be cut down, like cutting down the calories, more physical activities. Your cycles become okay. You are mentally more happier. Your hormones when you exercise, right? The serotonin, dopamine. These are the hormones, happy hormones. And meditating, such kids have to be put into some other physical activities. So those hormones take over, and you feel more happy. Yes, and you praise them when they start doing them, appreciate when they do some little things for their own benefit. These praises and rewards and all, they keep their self-esteem boosted up. They will do better. Instead of telling why you are looking so ugly, why don't you do this for you, the way of correcting a child, instead you be a part of it and you say, yes, we can do this, come, let's go for a walk, change. You start behaving with the child, you play with the child, you go play some shuttlecock. Mother is sitting watching TV, you go play. That can't be done. And mother is eating cookies, you can't say the child don't eat. So whole family should practice.
True. So for this group especially, I know we discussed that when teens come to your clinic and you notice such symptoms, you recommend them to therapists. But for this group of girls who might have mental health issues because of this actual physical disorder, therapy becomes even more important, right? Because otherwise, mental health and physical health are definitely tied together, but this is a definite problem which is going to lead to many more complications down the line.
Down the line, adult, as a mother, as a parent,
Yeah.
whatever you experience in your childhood, that is what you're going to do in your adulthood or in your parenthood. So
Yes.
lovely growing up years and happy experiences help you to be a better mother in the future, and you give a better future, right?
Yeah. Yeah. Right. Yeah, this should be very helpful to a lot of
Many
people.
many this psychological clinics have come up. Psychiatrists, pediatric psychologists have increased nowadays because they know the demand is more now.
Demand is more.
More.
I'm assuming that in urban centers the demand might even be higher,
Higher.
than in not urban
Yes, yes,
centers. Right. Right.
De-addiction centers have increased. There are no beds, I heard.
The
They take them as inpatients, for substance abuse,
oh
drug abuse. So the beds
right.
are not available. Means you need to have many more centers in the coming years.
Wow. Okay. Okay. So here I was talking about mental health disorders caused because of a change in environment and this new kind of world that we live in. But that's not all. There is also rampant substance abuse right here in India amongst children who are younger, who are not even adults right now.
Yes.
Wow. Okay, so these are all things that require, again, that old saying, no, that takes a village to raise a child. It will need a lot more than just parents. Like, I often think that communities would need to be
Community needs
responsible
to,
for the
definitely.
children, not
See,
just
if
your
a
children, maybe also.
father says yes, it is permissive parenting. I drink in front of my child. Why don't I let my child experience once at age, even before their legal age, like 18, they start giving drink. I have seen parents doing it. Why? What is there?
Wow.
What wrong is there? Experience, my son. Let him have it.
Yeah,
That thrill. He thinks yes, my dad is okay with me. It might start with once, then drinks become tobacco. Tobacco becomes some other things, drugs, marijuana, all that have increased. Then they start lying, they start cheating, they start stealing money from parents. These things
it's a
have also,
slippery slope.
yes,
It can go
and
down in any direction.
vandalizing, abusing parents. You might have seen many kids abusing parents physically, violations, hitting mother. I have heard that in Delhi he killed his mother. So such things, and here luckily we don't have
Wow.
guns. I hope we don't see that era where they start getting guns easily everywhere, start shooting
mass
people.
shootings.
Yes.
Yes, I know what you mean, doctor. Right. Another thing that I wanted to ask, we discussed COVID before briefly. The term COVID babies is very popular, doctor. But why was the term coined? Were children who born and grew up during that time, were they somehow different? Were they showing any different developmental growth or something like that?
See, COVID, which happened between 20 and
19
21,
and yeah,
2021.
2020, yeah.
So the first wave, second wave, third wave, each had a different role. See, first wave, we all got scared. We thought that infection will kill us, confined ourselves with lockdown. So that affected one way, but mothers who got COVID affected in another way. So I will first talk about mothers who got infected.
Sure.
So mothers who were having asymptomatic disease like mild cold, cough, flu, nothing happened. Those who had in the first trimester a significant disease had birth defects up to 3 to 5%, which is as good as the normal population. 3 to 5% of normal deliveries will also have the birth defects. So you cannot 100% say that it is because of COVID. And the studies are also not yet fully done. Like say, any study has to be more than 5 years, 10 years to say yes, it is because of COVID. But the studies which were done on a child, newborn baby and a baby which was 5 to 11 months, how development was studied compared to the controls and these babies. There were several studies done in different socioeconomic groups, different backgrounds. They have come to a conclusion that yes, there is a difference in the IQ. They say developmental quotient is low in those who were born in this COVID period. Why was there less environmental stimulation? We all got hooked up to our own, like we were in one home.
In a bubble.
Yeah, and we didn't get exposed to other environmental factors. We didn't take them out to play. We didn't talk to them much. They were also, screen time was more. So those things led to language delay and social milestones, interactive, logical thinking, problem solving skills. All that is less compared to the pre-COVID.
Pre-COVID.
Yeah. And I myself, when I was seeing in the clinic, so babies who came post-COVID, like clinic is not meant to just treat them. So here we evaluate a child. So when the child comes, when you're measuring them for the physical growth, we also see how they're developing, right? So development, like this age, you have to sit, stand, walk, all that is there. So we saw that there was significant delay. Motor milestones didn't get affected. They sat on right time, they stood on right time, walked on right time. But language, eye-to-eye contact, then speech was definitely affected. When we asked Dr. COVID time, Hena, we didn't give much attention. He's not speaking. 2 years, no words, not even a single word. And I also saw more cases of ADHD, autism. See, by 9 months, your baby has to wave bye bye. And when you call his name by 1 year, he has to look at you. And what's your name when you call, at least he has to make an attempt by 2. Or when you say pat a cake, they should do. Wave bye bye. Or in India, we say Ram Ram, they should do by 1 year, they don't do. And when you are calling, they are trying to see somewhere. There, because eye to eye contact is not there, no receptive, only receiving, but no reciprocation is happening. So definitely language took a toll. Speech was delayed, and ADHD, autism spectrum disorders are definitely seen more after COVID. Even diabetes has increased because they sat, obesity increased, diabetes incidence also has increased.
In little children?
Yes, it has increased. So these, and not only this, there's one education gap, kids who were doing very well got onto this television or this digital way of learning online. So who did well also, they started cheating. Now online you can cheat. So exams were online, they didn't do well. So those kids who did well academically, their academic performance also dropped. There was a big gap in immunization, which is more worrisome. See,
the vaccination schedule.
Yes, going to clinic for vaccination and getting checked up was the more important. But here they restrained themselves from going to the clinics. Everything became online. We started treating them for cold coughs through telephone consultations. So we missed on vaccines like measles, mumps, rubella, chickenpox, which were supposed to be given at birth from 9 months, again repeated 4 to 5 years. Those who make kids who took the first shot, but they missed at 4 to 6 years. Now we are seeing that they are getting chickenpox, measles. We are seeing measles encephalitis, dying. Chickenpox encephalitis means brain fever. Chickenpox leading to brain fever. We have seen deaths. We had never seen so many number of measles cases, which I saw in the last 6 months. So this bridge or the gap in the immunization is leading to worse consequences. COVID was okay, but these are deadly diseases than COVID. So diphtheria, pertussis, DPT, which they missed, at least the affluent society took some, where they went to the apartments, they went home to home and they delivered the shots. But the poor socio-economic groups, it has got very bad. And we are seeing more mortalities, more morbidities for the preventable diseases, which we had in our hands to treat. And we could have prevented by giving right time, right dose of vaccination.
And people, at least from what I heard, was that COVID might have been one of the first of its kind where we faced these, mass, everybody locking themselves up in their home.
Yes.
But these things can happen again in future because COVID kind of diseases.
This has happened in the past also. Plagues have affected.
Yes,
wars have affected.
Much worse than COVID.
Yeah, much worse has happened. Everybody has to cope up and move on, but some corrections needs to be done with such things.
Yeah, like these people would not have expected that. This would not have been the first thing that people thought of.
Not only that, studies are now saying that vaccines are causing problems. See, we are seeing young adults dying with heart attacks. 40s, they are having heart attacks. They are saying, is it the COVID vaccine, or is it the antibodies, or sometimes we took for the prevention of clot. The patients who underwent the COVID treatment, they were given anti-clotting drugs. So those are leading to bleeding. Such things are also, studies have to be proving.
Studies have to be conclusive.
Conclusive, but now there is no conclusive evidence to say that yes, COVID is the cause. COVID can be one of the cause. Now we also have newborns who are having surgical illness like intestinal obstruction and malrotations. When we thoroughly examine, COVID antibodies are found. So is it that mother had a asymptomatic illness and she has given that antibody to baby, and is that antibody causing these complications? We are still yet to know.
So there's much
more studies
need to be done so far
Yes,
as
yes.
COVID's effects in children
Effects,
is considered.
long-term effects, behavioral
Wow.
effects, still yet to know.
Wow. Okay. Yeah. Interesting. And like most things, scary again, right? What is happening in the world today in terms of, and its effect on children is always so much more severe than its effect on adults.
Because it's a developing brain, developing body.
Yes,
Anything
yes.
damaged now is permanent.
Yes.
Damage to kidney is permanent. So damage to heart is permanent. It's like that.
Wow. Dr. Pediatrics is such a challenging field, right? What would you say has been your favorite thing? It's not putting it very mildly, but what is your favorite thing about being a pediatrician?
See, every encounter with a child is like a divine appointment. Every child I see is like I'm meeting a god. They're so cute, they're so innocent. Whatever fear, whatever worries I have at home, when I attend the clinic, when I see the baby, smile on their face takes away all the worries. So that is the first thing. I was always attracted like a magnet to a baby. So, and that smile, no, that it can't be explained how we feel. So that is good. Another thing is when we attend as a newborn specialist, when we attend the deliveries, babies don't breathe. Then we resuscitate. Heart is hardly there, and we do CPR. And after that, after a few days, when you see a nice baby, live baby, which had lost hopes, and walk into your clinic after a year, wishing you that I have completed a year, what else you can have? That is the joy which you get. I had a baby who had no breath, no heart rate, nothing. We intubated, lost hopes, but some prayers and some magic. Baby is fine. Every year they come to me, every birthday they say, he is the gift which you have given, and
Wow.
completely normal. So babies do have such, when they have this stormy newborn period, like resuscitation period, they will have some IQ problems or language problems or learning disabilities, scholastic performance may be low, but this is completely a near normal baby. Such things keep you happy. And some days I had my night duties where I had a child who was dengue shock, single child. Dengue shock means you are bleeding everywhere, you are into coma, so not arousable. Single child, where we did our best, but at the back of my mind I knew that this will not survive. But parents said, it will happen, doctor, you do your best, you do your best. And she woke up after 7 days. It's a miracle, we never thought. She woke up, she's all fine. So there is, beyond science, there is something which God has to do. You're only treating and he cures it. So such things gives lot of happiness. But there are some times where we have to bear the bad news, right? So being a pediatrician, when we diagnose a disease which is terminal, and which is like leukemia or a chronic disease, where you have you know the end, you know how much, but you can't reveal it to them. You will say, yes, we'll try our level best, but in my heart I know that I can't do anything to this child. That is the worst possible feeling, as a mother or as a pediatrician, because you have seen the child since birth, and losing a child for such diseases which is not in your hand and nobody knows why it came is a worrisome thing. Worst thing as a pediatrician is to declare somebody dead.
Can't imagine that. That would take a lot of strength. That's where, I mean, to be a doctor, I mean, I salute all doctors, but yeah, that would take so much.
Very, very bad situation we are put into.
Absolutely. Yeah. No, and I hope that you have all the strength to do your job as well as you've been doing in the future as well.
See, family time, definitely we have to compromise. There are instances where I have admitted my own child and taken care of other rounds. When I had a baby after my MBBS. So I had a baby and I was doing my post-graduation. So I used to take my baby and to hospital on and off because I have to feed the baby. So that time he used to contract lot of diseases. Then I admitted him in a ward, but I did my course as a pediatric PG. So such things, such times I felt really horrible. Why did I choose this profession? Did I do a right thing? Am I compromising on my child? All that came up.
Must have been so
yeah,
tough.
very
I
difficult,
can't imagine,
very
doctor.
difficult. Yeah. But now when I see that they are grown up, I could motivate my time to the family as much as I could. But they were also very cooperative. They knew that she's not going to be there, but she'll guide us. They did on very well. Supportive kids, supportive husband. So I could do whatever I did. So I am thankful to my family too. See, and sometimes even in movies I've ran away to resuscitate from the movie or from the dinner, or never have celebrated any festival sitting at home. See, festivities come like serving child is like serving God, right? So you can't ignore baby and sit and do puja. So it is like that. So when you take your patient as the first thing, these things come secondary, and God is always with you if you are doing right. That is what I believe.
Yeah, no. Being a doctor's family would not be an easy task, because I can understand it. It would take so much support from your entire system.
Both
for you
being
to
doctors is furthermore, and he's a laparoscopic surgeon. He's also busy, but kids are more like understanding, I would say.
Yeah, they have more grace than adults.
Yeah, they understood the problem and they got coped up with the situations.
Wow, that's incredible. That's amazing. So just as we thank you, we thank them too. So what does the future hold, doctor? Right?
Future, see, I have graduated from a college where we served a lot of low socioeconomic groups, right? But I moved to Apollo, where I only cater to affluent society. But I have that guilt that I didn't do much to the other half, right? Social service, nothing I have done. So in my 50s, I would like to dedicate at least 1 hour giving time to them, either go to their neighborhood, serve them, or teach them, give them some health tips, or give some drugs, go to villages. These are my plans for future. And I didn't give much time to my parents who are aging. So I think I should give some more time because they will need me further. And I think I should travel more because I have not done anything more.
You've just been treating
Yes.
all the
I need to
children
explore
and their
world.
parents.
And when I am old, they'll be traveling and I'll be sitting at home. That is not okay.
Yes. Yeah. No, we wish you get time for all of these things, because all of them are such worthy causes. You've dedicated your life to children, to helping children. So we hope you get to do more of that.
Yeah.
And we hope you get to take care of yourself and your family and spend time as you wish to.
Yes.
Right? That should definitely happen. But thank you so much. Thank you so much,
Thank
doctor.
you for giving me an opportunity to unwind.
Yeah. Thank you so much for coming to the podcast.
Thank you, Amrita.
And as a parent myself, I feel that this one was a must-watch for all parents. If you agree, please share it with other parents, other soon-to-be parents, or anyone you think who should watch this video. Please like this video so that we can reach out to more and more people. And please subscribe to our channel for the next podcast, which will be out next week. Thank you so much for your time.